every week we spend valuable time shouting at each other as colleagues across the primary secondary care divide, defending our own personal, what we think, in the name of doing what we think is best for our patients. But in fact, we are shouting and scrabbling over a smaller and smaller pot of money. That is totally unacceptable. And the purpose and the reason for that is lies in its roots in what is called so-called competition and market forces, but which a former chair of council described very aptly as an infernal bazaar. That is what we have been reduced to as colleagues, and that these so-called reforms that pit clinician against clinician, colleague against colleague, practitioner against practitioner are totally unacceptable. Can I also say that although the second part makes particular mention of collaboration between primary and secondary care, let us not forget our colleagues in social care. And that in fact, actually, collaboration between health and social care is also crying out for reform and for a new impetus of energy and time.
STPs have been very unpopular because it's seen as a way of devolving down rationing to local level, and the blame therefore is done locally. But if the funding's there and we can get rid of the whole competition and the idea that this is to the lowest bidder, these would be potentially very powerful ways of working together to work out what our patients need across a patch and deliver what the patients need, rather than two hospitals locally competing to get the high tariff services. Actually, this is a good way of cooperating. We've got the structures there. With some changes in the Health and Social Care Act, we could make use these to make the NHS much more efficient and more cost effective than it already is.
I don't think we should ever talk about increasing tax without looking at how we could save money on the way the NHS is run at the moment. And in fact, you know, when May announced her 20 billion increase, which of course doesn't even start to make up for eight years of austerity in the NHS, there was a lot of talk about NHS wastage and inefficiency. You know, we know that the biggest wastage and inefficiency in the NHS is government policy. And you know, we waste something like, they won't tell us because they know they'll be embarrassed if they do, about £10 billion a year on a market which nobody needs in the English NHS. We're spending something like £80 billion of taxpayers' money to get £11 billion worth of infrastructure on PFI. We're spending money on management consultants instead of medical consultants. I could go on and on and on, but I won't.
The artificial boundary between the primary and the secondary care has to go, because the amount of money that is wasted, the amount of hassle that the patients have to face moving between primary care and secondary care all the time, being pushed like a ping pong ball, I think that has to go. If we have to improve our health services, if we have to improve our care for our patients, these boundaries have to be demolished. The funding, again, is divided between primary care, secondary care. That has to be one source to reduce any wastage. And that, along with the extra funding, and I'm not going to comment on the first, I'll leave it for others, but the extra funding and the savings by doing these, getting rid of these artificial boundaries, getting one financial source, that will save a lot and help our patients.